Hello students, I'm Dr. Ashu Mittal. Today we are going to discuss the methodology to conduct bioequivalence studies. Let us see what is the primary objective of bioequivalence studies. In bioequivalence study, an applicant compares the systemic exposure of a test drug product to that of reference drug product. For two orally administered drug product to be bioequivalent, the active drug ingredient or active moiety in the test product should exhibit the same rate and extent of absorption as the reference drug product. So we can say that bioequivalents are used to assess the expected in vivo biological evaluation of two formulation, that is test and the reference. So what are the elements of bioequivalence studies? It involves protocol, data submission and the result. So the protocol comprises of study objective, study subjects, study design, sampling, ethical considerations, under ethical consideration consent forms from the subjects, and emergency procedures. So next part is your data. Under data, you need to submit case reports, analytical data details for validation of assay methods, analytical data from biological samples. Under results, you need to submit summary of individual subject data, statistical analysis along with summary statistics. Now what are the objectives of bioequivalence studies? To compare the bioavailability of two or more pharmaceutical formulations and to identify bioequivalence between the formulations. Now what are these formulations? These formulations are reference formulation and test formulation. Now basically the reference formulation is innovator or original manufacturer product. It usually a formulation currently approved and marketed that is well accepted by the medical profession and has a long history of clinical use. Now study subjects. Now there are some inclusion criteria and exclusion criteria. We need to refer to these criteria before we enroll a subject for our bioequivalence studies. Now if a subject meets inclusion criteria, we can enroll him for our bioequivalence study. Now let us see what are these inclusion criteria. So the subject, he should be a healthy subject, male or female. The age should be between 18 to 55 years of age. Non-smoker without a history of alcohol or drug abuse, and the clinical lab test values must be within normal range. So under clinical lab test, it may be the kidney function test, liver function test, or cholesterol, and so many other parameters. So all the parameters, they must be within normal range. Now let us see what are the exclusion criteria. Subjects having the habit of consuming tobacco in any form, alcohol addiction or drug abuse, subjects having history of kidney dysfunction, jaundice in the past 6 months are avoided. Chronic illness such as asthma, arthritis or HIV positive. The subject should not be allergic to the test drug or chemically similar products. Subject using any enzymes induction drug for the past 3 months shall be avoided. Subjects who have participated in bioequivalence bioavailability studies in the past 12 weeks should be avoided. Taking OTC prescription drug for 2 weeks before the study. Now, what are the ethical considerations? Bioequivalence protocol must be approved by the ethics committee registered with the regulatory body. All good clinical practices guidelines must be strictly followed, and the main concern of the bioequivalence study should be patient interest and the patient safety. Analytical data. Let us come to the bioequivalence study designs. So these are the common designs which are used in bioequivalence studies. The randomized 2-sequence 2-period crossover design. Now what is period? Period refers to the time in which the study is performed. Sequence refers to the number of different orders in the treatment group. And treatment means the drug product or a formulation for treating illness in the subject or a patient. Now in crossover designs, each subject gets both treatment. The subject serves as his own her control. This minimizes inter-subject variability. Fewer subjects are required to achieve adequate statistical power, and treatment periods, they are separated by a washout period. Now this washout period is a gap between two periods. So this washout period minimizes the carryover effect. Now next is your balanced incomplete block design, that is BIB. So when drug products under study are more than three, then we use BIB, because Latin square design will not be ethically advisable, because the small subject is exposed to frequent withdrawal of blood samples. Now in BIB, each subjects should do not get more than 3 formulations. In case of replicate cross design, these designs are used for drugs with large variability, and in parallel group designs, this design is used when T half of the drug is very large. So such drugs cannot be studied using crossover designs, because washout period, that is gap between two periods, would be too long and not feasible practically. So these are some commonly used designs. Now let us talk about the sampling of biological samples. 3 samples before expected Tmax must be taken. Sample should continue for at least 3 months or more half-lives. Now why so many samples are taken in this bioequivalence study? Because they allow accurate estimation of Cmax and terminal elimination rate. It also helps us to capture 90% of the relevant AUC. Now sample should be taken single dose fasting or multiple dose fasting. Single dose fasting in case of the oral solution, and extended release old strength. But when we talk about the extended release product, and when we talk about the highest strength, then multiple dose steady state is used. Now single dose fat state are also used for highest strength. Now let us talk about the data submission and analysis. So the plasma concentration and time points are considered while submitting the data. Subject period sequence treatment should be discussed. Inter-subject, intra-subject and total variability, if available, shall be discussed in the data submission. And for single dose studies, the parameters which are considered are AUC 0 to T, AUC 0 to infinity, Cmax, Tmax, termination half-life and elimination half-life. Now let us see the data submission analysis. Now bioavailability is assessed using 2 main pharmacokinetic variables as shown in the figure 1 in the next slide. These 2 parameters are AUC, that is area under blood concentration versus time curve, and the maximum blood concentration, that is Cmax. Now how in data analysis, there must not be more than 20% difference between the AUC and Cmax of the innovator product, that is, or a brand name, versus generic product. This is based on international consensus that differences below 20% are not clinically significant. In order to establish bioequivalence, the AUC and Cmax for the generic drugs are compared with that of the innovator drug product, as shown in the figure 1. Now we can see here the figure where the AUC and the Cmax of the generic and the innovator product, they are compared, and if the variability is less than 20%, then we can say the products are bioequivalent. Now bioequivalence is based on the comparison of a ratio where the ratio of the generic to the innovator drug product for each pharmacokinetic variable does not differ by more than 8:10. This is how the range of confidence interval is defined, that is 8 divided by 10 is equal to 0.8. So when the ratio is 0.8, it gives the lower limit of 80%, and when it is 10 by 8, that is 1.25, it gives the upper limit of 125%. So the ratio of the Cmax and the 90% CI for the ratio of the AUC should be contained within the limit of 80% to 125%, as it was shown in figure 2. So thus bioequivalence is based on the ratio where nominal equality is 100%. It is not based on the differences in the absolute values. So this graph showing the statistical data analysis. In this graph we can see that the innovator product or branded product, this is the 100%, it is shown 100% and the ratio is 1, and these products, they are bioinequivalent because they are out of the range, and this product is bioequivalent because the range, the AUC range and the Cmax range is between the range, that is between 80% to this one. So let us talk about the results.